guys, hope you're well. Welcome to day 22 of the Arora AKT 30-day challenge. Thank you so much to everybody who mentioned that yesterday we mentioned day 22 and it was actually day 21. Today is day 22. I took a day away from you. Apologies. You've still got 9 days to go to AKT. Of course, hopefully you're feeling good. Hopefully you're feeling confident. I understand by now you're going to be getting ups and downs in terms of that confidence roller coasters. Sometimes you'll feel good. Sometimes you'll feel not so good. Perfectly normal. But hopefully your overall trajectory is going high. If you're getting up to that point where you're starting to think, you know what, I just want to do this exam now. I want it out the way. That's a good sign. It shows that you're hitting your peak. But you just got to keep on pushing. Every 1 or 2% makes a slight difference. And hopefully you can keep climbing up to get those extra few marks and work as hard as you can and smartly as you can, I'd say, in the remaining 9 days. So we're back onto stats again today, super stats. Another stats question. If you, hopefully, you're not one of those people who have not started stats yet. Hopefully you've done some work on stats. Let's see how you get on today. Have a think, 57 seconds. I'll pause, I'll go silent, and then we'll come back on the other side, look at the answer and see what we could have done to try and A, reduce mistakes, and B, learn through technique. On the side. 57 seconds, let's go. That is time, guys. 57 seconds. So, what is the right answer? The correct answer is A. Well done if you got A. Now, again, when it comes to stats, people focus, quite rightly sometimes on all the different graphs and calculations and how to work things out. But actually, there's a lot of stuff in stats, like we talked about in the previous stats. I think it was a previous stats video we did. That often is not looked at, and stuff like trials and types of study and types of research and bias confounding, triangulation, grounded theory, ethnography. These are kind of stuff that people don't often pay attention to because the graphs and the calculations take so much of your time. But sometimes these are marks that are worth working towards, because even if you get the graph stuff wrong and you can't figure out questions or can't remember, it just doesn't click in your mind, there's still lots of learning based stuff that you can do, and we'll cover a lot of it in our stats online course and also our stats audiobook. And this is one of the things that we cover. So the different types of research, the research pyramid, we briefly talked about a little bit of this in one of the previous questions. So your supervisor asked you to review the current available research about a new medication for treating phacocytoma. When reviewing the data, which of the following research types are written in ascending order in terms of research strength? So the first thing is to get that the right way around, ascending order. So starting at the lowest strength and reaching up to the top of the highest strength. And then as you go through the various trials and studies, A is the one that is in the right order. So we'll go through this in detail in a second, but case review, cohort study, non-randomized controlled trial, systematic review, meta-analysis. All the others have at least one error in there. And actually we'll come back to them in a second once we've gone through what these various steps are to look at where the error was if you put B, C, D, or E. So a quick reminder of the research pyramid. Normally you see a diagram like this. And it talks about how much strength you have depending on the type of study or research done. So starts at the bottom, goes up to the top. Meta-analysis, like I mentioned in one of the previous videos, is the highest form of research strength. But it starts at the bottom. So say you look at this example here, phacocytoma, there's a new drug out there in terms of management. Expert opinion is important. It's obviously more important than or more powerful than a layman's opinion. So if you get an expert in the management of phacocytoma and they say, you know what, this drug is pretty good, I recommend its use, you've got to take that with some, kind of You've got to take that with some level of surety because it's someone who knows what they're talking about. However, ultimately, it is just an opinion. Opinions might not be right. So this consultant might decide to write up 1, 2, 3, or more case studies about patients who have used this new drug, and maybe the case studies show that pheochromocytoma treatment is improved with that drug. So that's better than opinion because there's some kind of documentation there. Obviously, the more case studies you have, then the better strength that becomes. But that's your next rung up. Then you have observational studies. Now, observational studies come in 3 types: cohort, case control, and cross-sectional, the 3 C's of observational studies. Now, observational studies are just basically, as it says, observing. So you're not adding things in like placebo, for example. It's just you're observing stuff. Now, cohort generally is you're observing forward, case control generally observing backwards, and cross-sectional generally is like a snapshot, just what's happening right now with the population. So these are much better than case studies because you're starting to compare lots of different patients. So for example, you might have a cohort study where you have 10 patients who have pheochromocytoma and they have the drug, the new drug, and then you have another cohort of 10 patients who have pheochromocytoma who don't have the drug, and you look forward to see how people, what's the progress. So it's a prospective study, and then you can do some stats based on the answers. So that's an observational study. Then you have interventional studies. So people often think about these as your randomized control trials, but there are lots of different types of interventional studies. So these are studies where you're intervening. You're not just observing anymore, you're intervening. So for example, you get 10 patients with pheochromocytoma who are given the new drug, but then instead of 10 patients who are not given the drug, the other 10 patients are given a placebo. So then because you're giving a placebo and versus the drug, you've got intervention going on, which is better than just group who takes the drug and group who doesn't take the drug. So you can actually start to do some good stats. And then within these, you can have things like blinding, which can be single or double blinding. You can have randomization or not. And each of those things adds extra layers in terms of strength. Then you've got systematic review. So systematic review is now when you're starting to look at a bunch of different studies looking at the same thing and collating the evidence together. So you're going further up that evidence pyramid because you're getting strength in numbers. Systematic review is a qualitative review of lots of different trials looking at the same thing. So qualitative means without stats, so a descriptive analysis basically. And right at the top here, you've got meta-analysis, which is a quantitative review of lots of different studies. So numbers and stats basically get involved here, and that's why that's stronger than a systematic review. But both of these top two are looking at groups of studies that may feature lower down that pyramid. So that's what all of these are. Let's go back through the answers then. So as you can see, case review, stronger than that is as a cohort study, which is an observational study. Stronger than that is a randomized control trial, non-randomized control, doesn't really matter. It's an interventional study. Then comes systematic review, then comes meta-analysis. So that's correct. Which of the following is written in ascending order? And so that's correct. B, cross-sectional study and cohort study. You may think, both of those are obviously observational studies, so they both kind of sit at the same rung. But you may well put cohort above cross-sectional just because you are having some variation, 2 groups, and you're following them forward. Blinded trial, that is stronger than these two, of course, because you're looking at a interventional study. But then the thing that makes this false is, of course, the meta-analysis is the opposite way around systematic review, so that becomes incorrect. C, expert opinion at the bottom. Case control study and cohort study both essentially could be equal, although depending on how you run those studies, one may be stronger than the other. Systematic review is the far end one out of all of these 5, but a randomized case review is not stronger than these 2 studies. So that would go kind of here if you're looking at where does that fit into expert opinion, then comes case reviews, then comes, remember, observational studies. D, single-blinded randomized controlled trial is less powerful than this is a double-blinded cohort study. So this is what makes this wrong. Then you've got interventional trial, which is kind of a blanket term for different types of trial, like single-blinded, double-blinded, non-randomized, randomized. So it doesn't quite make sense, this order. This is right, obviously, systematic review, then meta-analysis, but it's this bit that's a bit muddled up. So a double-blinded cohort study doesn't really exist. Double-blinded references randomized controlled trial, so proper interventional study. So that's just a little bit muddled up. That's what doesn't make sense. And then E, a case review series. So that's fine. Cross-sectional is an observational study, which may be stronger. Randomized controlled trial is stronger than a cross-sectional trial. Meta-analysis is stronger than all three of these, but this is where obviously this one goes wrong, and this triangulated analysis is not really something that is known in terms of pyramid, and certainly wouldn't be bigger than a meta-analysis, even if it did exist, because meta-analysis is the peak of your research pyramid. So if you hadn't revised this, then, or you knew it vaguely, then this bit might have thrown you. What's triangulated analysis? Never heard of it. And sometimes what people do in an exam like this is when they see something that they haven't read, then somehow it draws you towards putting that answer. Oh, I don't really know what triangulated analysis is. That might well be right. I'm not quite sure. Let's put it down as the answer. And you may leave a lot of marks behind just by doing that. So sometimes, and even by the way, if you kind of thought that A was right, this might draw your brain towards putting that as an answer. This happens so often when it comes to these types of exams. So look out for that feeling of, oh, I don't quite know what that is, but let's maybe put it down because it's probably the right answer. That happens a lot. If you're certain that one other one is right, don't let that sway you just because you're not quite sure, because you've not come across it before. So hopefully that kind of makes sense if it comes up in exams coming forward. This is covered in more detail in our stats online course we mentioned earlier, the AKT Super Stats online course. This is a course that you can pause, watch, rewind, watch on screen. Teaching is similar to how I've been doing the teaching in the stats questions till date in the 30-day challenge. Obviously, lots and lots of different things covering both those things that people often worry about more, like the graphs, of course, and like the calculations and the equations and how to work all of those out, but also the other bits like we mentioned, stuff like errors and hazard ratios and other bits that people often don't focus on, that actually can hopefully give you some pretty easy marks when it comes to the exam, even if you get the graphs and the numbers a bit wrong and you struggle with those. So have a look at the website. Make sure you use the coupon Arora Video 10 as always for any of the AKT stuff that we do, whether it's online audio mocks, flashcards, or anything else that you want to book from an AKT point of view. And remember, you get the full PDFs as well. So if you get the stats course and you want the PDF slide package, you can still make full use of these 9 days. Then send us an email and we'll send you the full PDF slide package as well that you can print on, make notes, and watch as you watch on screen. But hopefully today was of some value. We'll be back tomorrow again with another clinical question. Have a good day, whether you're watching this in the morning, the evening, middle of the day, or the middle of the night. And we'll see you tomorrow. Take care.